I'm Angela Stratman, and tonight I will be discussing the intervention of trauma-focused cognitive behavioral therapy and the implementation of this intervention within a pediatric primary care clinic here in Cincinnati, Ohio. So with this project, some of our goals are to help increase the availability of efficient mental health care for a child who has either PTSD diagnosis and has suffered psychological trauma, and then also to reduce the PTSD symptoms, as well as some of those comorbid conditions that could be associated with that psychological trauma. The intervention is for children ages 7 to 17, so it's school-age children that have had psychological trauma. We would be using the intervention of trauma-focused cognitive behavioral therapy, or TFCBT, and that's within a primary care setting in a large pediatric hospital. By the age of 16, 2/3 of all children have incurred some form of trauma, whether that's domestic violence, violence in the community, physical abuse, sexual abuse. It could be medical trauma. It could just be death of a family member. Anything that the child deems as trauma and that has created some PTSD symptoms and a PTSD diagnosis, we would use. Childhood trauma can increase the risk for developing a mental health disorder, substance abuse issues, as well as emotional behavioral problems. It's been identified in our country right now that we have a large mental health issue and not enough care. So in Healthy People 2020, they identified an improvement objective to help increase the proportion of children that are actually able to receive care. So in 2008, 68% of children received mental health care that had mental health issues, but that still left 32% of children that were unable to receive mental health care for their psychological issues. So trauma-focused cognitive behavioral therapy, or TFCBT, is an evidence-based therapy. It uses the practice model, typically 10 to 15 sessions. The practice model is pretty easy, so psychoeducation, parenting teaching techniques, relaxation to kind of help with anxiety, decrease that, affect modulation, cognitive coping, so kind of connecting those thoughts and feelings with the trauma, and then trauma narrative, which is kind of like the heart of the TFCBT. It kind of looks at has the child look at the trauma, verbalize their trauma, and kind of figure out, what their triggers are and start to process the trauma. The in vivo exposure would be to actually help them decrease and master some of those trauma reminders. It is parent-child with some parent-child conjoined sessions, so that way it gives kind of the parents some techniques to also be able to help their children. And then just enhancing safety, so being able to kind of create a safe environment for that child so that they feel safe and feel like they can kind of decrease their triggers and let their guard down a little bit. At the center of the poster, you'll see kind of like my timeline for implementation of this project. So it all started with a PICO question, looking at the evidence-based research, and then it kind of delves into more of like the actual implementation of this project. So we would be recruiting participants within the pediatric primary care clinic at Cincinnati Children's here in Cincinnati, Ohio. It's a large pediatric clinic in a just urban community. We would be implementing this, so children that are at high risk for trauma, have been identified as having trauma in the past or in their family, would go and take a CAPSCA assessment with a trained therapist that's employed by the clinic there at Cincinnati Children's. And then based on their CAPSCA assessment, if they have a PTSD diagnosis, then we would implement the intervention of TFCBT. The TFCBT would be scheduled and all performed within the clinic. So the patients wouldn't have to, find another clinic. They wouldn't have to go elsewhere. They wouldn't have to travel outside of their community. They would be receiving the care within the same setting that they're receiving their medical care for health visits and sick visits currently. We would be using the CAPSCA assessment, both pre and post therapy, and that's just to kind of help us gauge what their PTSD symptoms were prior to, and then what their PTSD symptoms were like post. It would implement 12 sessions, so between that 10 to 15 sessions of TFCBT, it would all be done by a trained therapist. It would follow the practice model, and that would include any non-offending parents. The CAPSCA scores would be assessed, and then we would also be looking at any comorbid conditions that the patient may have had either as being present or absent prior to, and then either being present or absent post therapy. So again, the CAPSCA data, the CAPSCA assessment, it's the gold standard for assessing PTSD symptoms. It assesses the frequency, the intensity of 17 different symptoms that are associated with PTSD. It also gives the symptom frequency, and it's rated on a 5-point scale, and then each one of those symptoms is totaled up to kind of give us a severity of how the PTSD, how severe it is. We'll also be assessing, like I said, for the comorbid conditions, whether they're present or absent. CAPSCA was designed by mental health professionals, and it was based on the DSM-4 diagnosis. It was designed for the clinical assessment of children and adolescents, and like I said, it's the gold standard for assessing PTSD in children and adolescents. The goal of this project is to help decrease those children who are not getting efficient psychological treatment with their psychological trauma. With trauma being a risk factor for mental health issues and substance abuse issues, if all of those kids went untreated, it could potentially compound the issue that our country is currently facing with the mental health epidemic. There's multiple studies. In the study in the Webb et al., it actually showed that PTSD symptoms decreased from 54% initially at baseline to 9%. So that's 54% of the population sample who identified as having a PTSD diagnosis to just 9% of the population sample after 12 months of TFCBT treatment. It is an evidence-based practice. It has shown in many studies the decrease of PTSD symptoms. And it would be a benefit to be able to implement this in a pediatric primary care setting where children have potentially been diagnosed or are at high risk for developing PTSD. Thank you very much for allowing me to present on this topic. It's a topic that has greatly impacted my heart and I feel very passionate about. If you have any questions, you can email me or further ask other questions in the discussion board. Thank you very much.